time. Keely, I'm going to be your nurse today. Wash my hands real quick. I'm here to do just a quick physical assessment on you. So, have you ever had one before?
Yeah.
Okay, so you know we'll be sitting, standing, lying, just because I have to assess all the body systems. But it shouldn't take too long and it shouldn't be uncomfortable. First, can you tell me your name and date of birth?
Christopher Fulkerson, 7/11/96.
Okay, and you know what year it is?
2009.
Do you know who our president is?
Donald Trump.
Okay, so the patient is alert and oriented times 4. I'm going to start by just getting your blood pressure. Blood pressure was 110/68. Now I'm just going to get your pulses. I'm going to start with your radial pulse. And the pulse is 76 and the respirations were 16. Get your brachial pulse here. And it is a grade 2. This pulse was also a grade 2. So I'm going to get your popliteal pulse here. And it is a grade 2. You want to go ahead and take your shoes and socks off for me? I'll get those other pulses. And you can just leave them off because I'll have to assess your feet later. Here. I'm going to start with your dorsalis pedis, and it is a grade 2 in your posterior tibial. It's also a grade 2. Okay, how are your pulses assessed, your vital signs? Now we're going to move on to your skin. I'm just going to pull your shirt up quick here. Skin is warm, dry, intact. I don't notice any lesions, deformities. Do you have any pain? Okay. Skin turgor has good elasticity. Capillary fill is less than 2 seconds. And I can't assess the capillary fill on the toes because the nails are painted. Now we're going to move on to your head. Skin has good integrity also. You have good control of your head because you're sitting up fine. It is symmetrical to your head. The size is appropriate to the rest of your body. I'm just going to feel around for any bumps, lumps, or bruises, and I don't note any. The hair is evenly distributed, no parasites. The hair is brown. Did you have any pain? No, it's on there. Okay. Can you roll your neck around for me? And that's a range of motion in your neck. And can you push against my hand? That's muscle strength grade 5 on the neck. Now, for your face, I'm going to palpate your sinuses here and just tell me if you feel any tenderness at all.
No.
Okay, and your temporal artery, bilaterally, it's grade 2. Can you squint your eyes? Can you raise your eyebrows? Can you palpate your cheeks? It's cranial nerve 7 intact. Can you clench your jaw? And that is cranial nerve 5 intact. Can you open your mouth? And that's the temporal mandibular joint. Did you have any pain or resistance there? Okay, so that is good. Now we're going to move on to your eyes. Just need you to look straight ahead for me. Okay, so direct and consensual response are there. Just keep staring straight ahead. Accommodation also. The patient has perla, pupils equal, round, reactive to latent accommodation. They are a size 3. They are symmetrical to the face. The sclera is white. They are round. Can you pull your eye down for me? And then the conjunctiva is pink, no unusual drainage. Again, can you just stare straight ahead for me? Just follow the pin light. And through the eyes, I assess cranial nerves 3, 4, and 6, and they are all intact. So now we're going to move on to your nose. Just look up for me. The septum is not deviated, no unusual drainage. The mucosa is pink. Do you have any pain when I feel on your nose? Okay, and can you sniff for me? Okay, so patency is good. The nose is symmetrical. Now I'm going to have you close your eyes, and I'm going to wave something through your nose, and you tell me what you're smelling here.
Alcohol.
Okay, and that's cranial nerve 1 intact. So now we're going to move on to your ears. First, I'm just going to feel the ears. Move to this side. They are symmetrical to the face when I'm looking at them. The external structures, no lesions. The color is appropriate to ethnicity, as was the skin on the arms and legs. Do you have any pain when I'm feeling here?
No.
Okay, and no drainage or anything. Okay, I'm going to pull up and back. The tympanic membrane is pearly gray, translucent, no drainage, lesions, or anything. Inside is pink. And I would do that bilaterally there. I'm going to come behind you. I need you to close one of your ears, and I'm going to whisper a word, and you repeat it back to me.
Football.
Okay, and that's cranial nerve 8 intact. So now we're going to move on to your mouth. Can you swallow for me? Do you have any trouble with that?
No.
So that's cranial nerves 9 and 10 intact with gag reflex. Can you stick your tongue out? Can you move your tongue around? And that's cranial nerve 12 intact. Okay, can you stick your tongue out for me? The buccal membranes are pink, moist, no lesions. The hard and soft palate go from light to dark, which is normal. Can you lift your tongue up? Floor of the mouth is pink, no lesions. The mouth is moist. Can you stick your tongue out and say ah? The uvula does rise and fall with speech. Tonsils grade 2. The tongue is pink, light pink, and there's no lesions in it. Nose fine. There are 32 teeth. Didn't notice any caries or anything. Do you have any pain in your mouth? Okay. So now we're going to move on to your neck. I don't notice any pulsations or JVD here. I'm going to assess your carotid pulse bilaterally. It is palpable, grade 2. Feel your trachea. It is midline. The neck is symmetrical. Do you have any tenderness on your neck? No masses, lesions, anything like that. You do have good control. I've already tested your range of motion and your muscle strength. So now we're going to move on to your lymph nodes. I'm just going to feel. I'm going to start with the pre-auricular, post-auricular, occipital, tonsillar, submental, submandibular, superficial cervical, deep cervical, posterior cervical, and supraclavicular, and none of those are palpable, which is a normal finding. So now I'm just going to assess your breath sounds. If you just want to take your badge off for me. I'm going to start anteriorly. Okay, no adventitious breath sounds there. I'm going to go posteriorly. Okay, no adventitious breath sounds there either. Do you have any trouble breathing?
No.
Okay, so the effort of breathing is okay. There's no shortness of breath or anything like that. Now I'm just going to put my hands on your back, and can you take a deep breath for me? Okay. Expansion is good. Rises and falls equally. Configuration is 1 to 2, which is normal. Did you have any tenderness when I was feeling over your chest?
No.
Okay. So now we're going to come around. Listen to your heart sounds here. I'm going to start at the right sternal border, second intercostal space, and that is your aortic. Second intercostal space, left sternal border, is pulmonic. Third intercostal space, left sternal border, is Erb's point. Fourth intercostal space, left sternal border, is tricuspid. And fifth intercostal space, mid-clavicular line, is your apical. And I'm going to listen here for a full minute. And the apical pulse was 78. No murmurs noted. S1 and S2 were noted, so that is normal finding. We're going to move to your upper extremities here. So I'm going to have you roll your wrists. Can you move your arms out? Bend them. Can you roll your shoulders? Hip them in front and behind. So that is active range of motion in the wrist, elbows, and shoulders. Can you show your shoulders? That's cranial nerve 11 intact. Can you squeeze my hands? Can you push against me? Pull against me? So that's muscle strength grade 5 in the arms and hands. Can you touch like this? And that's your fine motor skills, which are intact. I'm going to assess your joints here. Have you had any pain in your joints?
No.
I'm going to do this bilaterally. There's no deformities or anything in the joints. Good integrity in the skin again. I'm going to feel the epitrochlear of your nose, and they are not palpable, which is a normal finding. Can you hold your arms out for me? And they are symmetrical. So now I'm going to move on to your lower extremities before I have you lay down. Can you straighten both of your legs out for me? And they are symmetrical also. Already felt your pulses, so we're just going to do some muscle strength and range of motion. Can you roll your ankles around for me? Can you straighten your knee out? And can you move your hip? Okay, so that's active range of motion in the ankles, knees, and hips. Can you push against me? Can you pull against me? Can you pull and push? Okay, so that is muscle strength grade 5 in the ankles and legs. Also active range of motion. I'm just going to look at the bottom of the feet, and there's no lesions, deformities, bruises, anything. Also on the top of the feet, and I'm looking at the toenails, no ingrown toenails, and they're all intact, so no problems there. Just going to have you to relax, and that is the quadricep reflex assessed, which is intact. So I'm just going to have you to lay down. While you're laying down, I'm just going to pull your pant leg up, and there's good integrity of the skin on the legs also. It's warm, intact. The hair is evenly distributed. So I'm just going to inspect the abdomen first. It is soft, round. The umbilicus is midline and it is inverted. That's your vowel sounds now. I'm gonna start in the right lower, right upper, left upper, and left lower. And I'm gonna listen for 5 minutes in each one, and they are normal active times 4. When I feel if your stomach is painful or tender, so the abdomen is also non-tender. Can you tell me the date of your last bowel movement?
Yesterday.
Okay, and do you have any problems with urination or bowel?
No.
Okay, so you can go ahead and sit on up. And that's all we have for your physical assessment today. Thank you.